Don't worry, I already know my phone's popped up. But pretty much this is terminology and theories for lifespan class. And it's just a quick reference for me in case I don't have time to go through my flashcards. So let's go. Health is the state of complete mental, physical, and social well-being. Function is defined as the ability to fulfill a purpose related to a person's occupation. Risk factor is the awareness of impact that one's disability or disease may have upon their health or function. Two models used in lifespan, that's how we view our patients, would be the social and medical model. The medical model is looking at the person, their impairment, and the cause of their health condition. The social model is focusing on a person's loss of function related to their health condition, and are they still able to overcome or master their environment. Performance context, that's looking at a person's function and their contextual aspects, pretty much just a snapshot of both those in one. Function includes body structures and body functions. Examples, cardiovascular systems. Example of function would be the heart and how it pumps blood. Contextual includes person's personal and their environment. Personal makes up their motivations and their culture, which also influences their personality. Environment is social environment, physical environment, and attitudinal environment. Barriers are limitations to healthcare, and facilitators, they support healthy participation. A lack of function affects a patient's what would be their activity level and participation level. Those range from activity limitations to function for activity level. For participation level is participation restriction to performance. ICF stands for International Classification of Functioning, Disability, and Health, and pretty much they're looking at a person's health and their quality of life. Reimbursements for ICF are based on what? Qualifiers, and qualifiers range from none to complete, and that looks at a person's body structure and body function. Lifespan development focuses on what? Be age normatives. Normal patterns of behavior, normal patterns of development and milestones starting in infancy. Normative is pretty much consistent with general patterns and experiences. Non-normative, also called atypical, is not consistent with general patterns or experiences and also adapting to a disease or disability. Human development should be functional and has three domains. These domains are cognitive domain, affective domain, and psychomotor domain. Functional domains are ADLs and domestic life domains are IADLs. What are theories? Theories are ideas, concepts, principles, observations based on facts and can be tested and disproven. Why do we use theories? In occupational therapy, we use theories to observe appropriate maturation, development, and learning to make sure that the behavior is appropriate for their age along with their reaction and response. What is developmental theory? Changes are attributed more towards maturation than to the environment. Three parts of development are maturation, which is growth, development of performance, and learning of new behavior. What is maturation? Maturation is a person's growth biologically, socially, and emotionally. Maturation, it starts at infancy and in the brain. Learning happens through repetition and practice, and also when you think of learning, think of skill development because you're developing a skill when you learn. 5 classifications of developmental theory would be nature versus nurture, quantitative versus qualitative, stability versus instability, reductionist versus non-reductionist, and organistic versus mechanistic. Nature versus nurture is genetic influences behavior versus role of the environmental experiences. Quantitative versus qualitative is pretty much the uniqueness of an individual, how they are based on how someone performs compared to the number of skills acquired. Stability versus instability, being able to anticipate behavior versus not being able to understand or anticipate behavior or consequences. Reductionist versus non-reductionist, viewing behavior as smaller broken down parts versus viewing behavior as a total whole without being broken down. Organistic versus mechanistic is how human beings act on their environment versus how humans react on their environment. We're gonna be looking at the affective domains, and pretty much that means that these are domains that include characteristics that underlie feelings.